Hello, everyone. Happy Monday. I'm Rendi Murphree, epidemiologist and director of disease surveillance here at the Mobile County Health Department. I haven't mentioned lately, but we are not in the media room where we had spent most of our Facebook Lives with you, but we're in our studio. Our media room has been sort of temporarily converted into a training location for all of our new COVID staff. So we're here on this somewhat windy and rainy Monday to give you our Monday update on the effect of COVID-19 pandemic on the world and Mobile County. So globally, there have been 23.5 million cases of COVID-19, and we surpassed globally the 800,000 deaths mark, and there are already nearly 810,000 deaths. In the U.S., around 5.7 million cases with nearly 177,000 deaths. And in Alabama today, they're reporting on 110,769 cases of COVID-19 with 1,950 deaths. I look at these numbers and am just taken back by how serious and lengthy and unprecedented this COVID outbreak is. It's just something that I never thought I would see in my lifetime. I mean, we'd been preparing for it for many years, 10 or 20 years, and to see these numbers going up the way that they continue to rise globally is really shocking. And I'm glad that I'm here to help the Mobile County Health Department and our community through this challenging time. So we had, again, our daily report and our weekly expanded report came out this afternoon. For today, we're reporting 11,734 cases. 27 cases were added yesterday. So since Friday, we had 32 cases added. Well, let me go back. So on Friday, 69 cases were added on Friday, 32 added on Saturday, and 27 added on Sunday. So this is really good news that we are seeing a dramatic reduction in the number of COVID cases reported to us on a daily basis. So also last week, the total number of cases reported to us last week, the week ends on Saturday, remember, was 551 cases, and that was less than half the number reported to us the 7 days prior. So again, half as many cases reported last week as reported the previous week and the week before that. So 3 weeks ago, it was around 1,000 cases. So it does look like we have sustained decline in the number of COVID cases reporting to us. We have 252 who have died. That's an increase of 4. And the cumulative number of people hospitalized in Mobile County with COVID-19 is 1,703. That's an increase of 23. So let me just remind you a little bit, some of the information from one other thing from our daily report. Yesterday, around 142 people were currently hospitalized with COVID, and that also is trending down, which is good to see. We've seen a pretty steady decline in the number of people hospitalized on any given day for COVID over the past 2 weeks. So those are really good indicators. Another indicator that we use is the percent of laboratory tests that are positive. This is found on page, I'll get to it in a second. I don't have a lectern here like I have in the training room. Okay, page 7 of our weekly expanded report. Again, this report uses data through the previous Saturday. And on page 7, it's figure 8, you can see that the percent of laboratory tests that were positive is around 8%. And I was really glad to see that the number of tests performed, it's still not nearly as high as it has been in the past, but it went up a little bit. So I hope that people have been hearing me say, please continue to get tested if you have symptoms with COVID or if you have been exposed to COVID and developed symptoms. We want to make sure that the people who need to get tested for COVID are getting tested. We have plenty of testing capacity. It's just that sometimes the PCR tests are delayed depending on what lab you're using because of manufacturing limitations on reagents. But there are many, many more rapid test platforms coming online, and you'll continue to see some more information about that. So just some descriptors about our COVID cases. We are still seeing that the highest number of cases are in that 18 to 24 age group. Everything is down for the most part, but in the small numbers, we're still seeing that it's that 18 to 24 age group that has the most cases among the ones among the other age categories. Still mostly female, still around let's see, 34% African American, 22% white, but we know that about 40% are unknown or missing. So again, most of those demographics are not changing much day by day. They do change sort of through the seasons. We've talked about that, where early on it was mostly older adults because that was who we're testing. Then once summer started, we began seeing more of that younger population, and we'll continue to keep a close eye on that as schools return. So the 7-day and 14-day average number of cases reported is down less than 100 per day. So again, that looks like it's around 70, 80 per day, depending on which of those you look like. The moving average in the number of hospitalized patients each day is trending down. That's good news. We still have just around 2% of the people hospitalized under the age of 25. So that's excellent news that in that 0 to 24 age group, we have only 35 total that we know of that have been hospitalized. So that's good news. Our death curve we're still seeing the delayed rise in the number of deaths. That is going down a little bit, but that may take a little bit more time as we have this, lag time from when people are getting infected to when they're getting sick to when they're going into the hospital and then when they are dying with COVID. So when we see a spike in people getting test positive or getting sick with COVID, we always see a lag in the number that are hospitalized and die. But it's good news that it does look like it's starting to go down, so we'll keep an eye on that. And also just remember that only 4% of the people who died with COVID are less than 50. So we've only had 8 people less than 50 years old that have died with COVID. I don't talk about this much, or I haven't mentioned it much recently, but we continue to see outbreaks of COVID all over town, in schools, in daycares, in businesses, in congregate settings, in detention centers, in group homes. So that is happening, although we are starting to see improvement in our nursing home outbreaks. In July, the nursing homes were doing really well, had been doing much better in June and early July, and then things started heating up a little bit more in the nursing homes once people started moving about and not knowing that they had been infected when they went to work potentially. So our nursing homes are now starting to see some improvement. We have, I think, 26 of our 37 long-term care facilities that currently don't have active transmission ongoing. So we continue to monitor that situation extremely closely and talk with our partners in long-term care facilities on a daily or weekly basis. So just haven't talked about that in a while, so I just wanted to mention that. Excuse me. So today, we're going to tag team this Facebook Live. So Dr. Chavers is going to come in and address your questions.
All right. Hello, everybody. I'm Dr. Scott Chavers with the Mobile County Health Department, And I just wanted to go over some questions we received and maybe possibly provide some answers there. So we did have a question about the NFL and the 77 false positive tests that were received from one lab. The question is, do we use the same lab, and could we be seeing some false positives over the last? Could we have seen some false positives over the last few months? So we actually have used this lab that the NFL used for this weekend's test. We have not used them in quite a while, and looking at the proportion of positive tests to negative, we really haven't seen any issues like they did here. The NFL did investigate, and it appears that this was a point contamination issue in the lab, and so they caught that pretty quickly. The second question is on what is the latest on the saliva test for COVID. So this has been in the news quite a bit lately, and there are several advantages to the saliva test. First, you don't have to use the nasal swabs, which for many people can, cause some discomfort. So you do get around that because you're giving a saliva sample in a tube. The tests that have come out recently that you may have heard about came from Yale School of Public Health, and basically it is a quicker test than the standard PCR test because it removes a component of the testing. What's interesting there is that component is also the component that slowed down and delayed some of the reporting in terms of the results from standard PCR. So it is a faster test, but it's not a point of care test. We still don't know in terms of how well it behaves in the real world, what to expect. So as those tests roll out, we'll be watching those. And then the question goes on to say, when might we see these available to the public and maybe in a take-home fashion? So the tests are really not ready for take-home. These do require special laboratories that have a special certification it's called a CLIA certification, but basically that just means that they're equipped to do very complicated testing. With respect to it being available to the public, I know that the Yale test will be made available to the CLIA labs first and then to nonprofit labs after that. But they are pushing it, and hopefully we'll see that in the next month or so. So we had a question, what rate of positivity do we have? If only those with symptoms are being tested, would you say that the positivity rate is actually higher? So the rate of positivity that we're seeing right now is about 8%. It's come down over time. I can say that just in terms of basic surveillance, and you have to remember the type of testing we're doing is people are kind of presenting for tests. This is not widespread testing, so the actual rate is probably higher than what we're seeing. That difference and how much higher it is, we're unsure of. The next question I have is how many people currently have the active COVID-19 virus? So that's an interesting question because what we do is we report the cumulatives that are out there, and the question goes on and say that millions have already gotten better. So that's true. So the way that we would estimate that is we would take the prevalence. So this will get a little technical, but we would take the current prevalence, look at the new infections, and then look at the duration of the disease. So the equation is prevalence equals incidence times duration. And right off the top of my head, I don't have the answer to that. So I will do that and see if I can't come up with some calculations for you. And then the final question, and this is one that we've talked a little bit about internally, is do we think that the continuation of COVID mitigation methods, so things like mask wearing and social distancing, might help lower cases of flu and other communicable diseases? So we are getting into the flu season. The other infectious disease that we are concerned about during this time of year is RSV. So those are definitely coming up, and those are seasonal. But the way that you can evaluate this is you can look at the experience in the southern hemisphere. So remember that their flu season is opposite of ours. So they're coming through their flu season, and they have also been affected by COVID-19. And what was interesting is if you look at the experience from the southern hemisphere, like Argentina, Chile, Australia, and South Africa, they have seen substantial reductions in influenza rates. Now, whether that is because of the mask wearing or issues with surveillance, we're just not sure. We'd also have to look at what the vaccination rates were. We're anticipating a urgency in influenza vaccinations this year, and we encourage everyone to get their influenza vaccination because that helps distinguish between influenza and COVID-19 infections because they can present similarly. So the rest of the question is, should this become an acceptable standard in society, which would be mask and social distancing? And I think that really depends on the circumstances. So this is just my opinion. If we're in a situation like we're in now with the COVID-19 pandemic, one of the ways that we're addressing that is these non-pharmaceutical interventions like masking and social distancing. And as the curve comes down, we'll eventually get to the place where we won't require or won't ask for the Mobile County Health Department, is really in a position where we heavily advise these things, and then we are under a mask order from Governor Ivey. But we would hope that one day when the background prevalence decreases to a safer rate, then we can back off some of these mitigation programs. So thank you very much. And we would also like to remind you that the Labor Day weekend is coming up. So please, we don't want to repeat the July 4th infections. So please keep in mind these mitigation activities of mask and social distancing. Thank you very much.